We now head to South Africa, where President Cyril Ramaphosa will today publicly sign into law the National Health Insurance Bill, which directs the transformation of South Africa's healthcare system to achieve universal coverage for health services and, through this, overcome critical socio-economic imbalances. The Health and Allied Workers Indaba trade union has welcomed the signing of the bill, as its goal is to allow all members of the public to assess healthcare and the final steps towards the enactment of the bill. Meanwhile, some civil organizations have declared that they will take legal action into consideration. The Business Interests Association has expressed regret over the law's current shape on several occasions. In the past, it has petitioned Ramaphosa to not sign the measure and to send it back to Parliament. Now to discuss this, we're joined by Rich Sicina, HAITU President. Good morning and welcome. Good to have you on this morning.
Good morning, my leader. Thank you for having us, and good morning to the viewers at home.
Great. Now, it looks like there's a lot of misinformation out there about the NHI Bill. What exactly is the bill about, and how do citizens understand what it entails?
Yes, there is actually a misunderstanding. And those who are making a lot of noise, particularly negative noise, they are talking from a point of ignorance and they talk of a point of lack of information in particular, because the people think that because public healthcare system is failing in a way, it's falling apart, it's dysfunctional. There's a lot of problems that we are facing in public sector. There's gross shortage of staff and gross shortage of material resources. As a result, those who are financially well off, who are beneficiaries in particular of private sector, it's them who are anti-NHI, who are saying, no, don't bring NHI. We can't have a healthcare system under government, because government has failed public healthcare system. As a result, that particular NHI will fall apart as well. So they are actually saying no to NHI from a point of privilege, because they want to continue to be beneficiaries of a well-resourced private sector. So as Health and Allied Workers in Indaba Trade Union, we are saying let NHI come, because we believe it's going to be the greatest equalizer. It's going to put us under one roof. We are going to sing from the same hymn. We are not going to have a two-tier system in South Africa, but we are going to have a system, a healthcare system as enshrined in our constitution, that is going to make sure everyone who lives in South Africa, when you are at your most vulnerable state, a state of sickness, you get quality nursing and medical care.
Okay then, Sicina, so it seems there's a lot of people, a lot of parties who are opposing the signing of this bill. What's your take on these parties?
They are out of order. They are out of order, my leader. Those parties, if you pay attention and you zoom closer to say who is actually anti-NHI, it's the parties that are sponsored in South Africa by white monopoly capital and those who are owning means of production in South Africa. People who are anti-NHI, or parties who are anti-NHI, are those who are sponsored by the $1 million business, the business of medical aid schemes. Those who are anti-NHI in this country are those who are the DA, for example, of which it's a DA, we all know it's a national party reloaded. So those who are anti-NHI are scared of equality. They just want to keep this inequality in South Africa going. So now they realize that obviously, and like I'm saying, with NHI is going to be the greatest equalizer. That is what they don't want to do. They want to continue to benefit. Actually, they are our misery, our pain as poor black people, Indians and whites in South Africa. It's their $1 million business. It's those people who are actually opposing NHI. They don't want to be admitted in the same hospital as their voters who actually have voted them into power. It's selfishness. It's evil-heartedness. They are just displaying an I don't care attitude. people of this country, voters in particular, they are only important when they have to go to vote. But when they are sick, it's okay for them to subject it to mediocre and substandard way of doing things.
Okay then, Sicina, so it's one thing to pass a bill into law like Ramaphosa is going to do today, then it's another thing if these bills are sustainable. So the question about the NHI bill is it sustainable in itself?
We must make it sustainable. Yes, there are countries where we are told that no, there are third world countries that have tried this universal coverage, but it didn't pass. Why Africans in particular are undermining themselves so much? Why are we saying it's not sustainable? We don't even want to try it. The biggest question that we are supposed to be asking ourselves in this country in particular is to say, how do we make it work? It can actually work if we didn't have those opposing, but if we didn't have private sector opposing NHI, and we all know they are going to make sure it collapses. But if you look at it and the problems that is going to fix in this country, you can tell that if we are all singing from the same hymn and everyone educated or not educated, whether you have money or you don't have money, in particular the educated elite in this country, the educated fraternity of this country is capable. In Africa, particularly, we are capable of making universal coverage in as far as health is concerned work for us. We are actually capable of doing that. We can make it work. It looks like it's not sustainable for now. When you look at what is happening in public sector, when you look into corruption, when you look into the fact that South Africa is still controlled by those who are owning means of production, white monopoly capital in particular, that exists to maximize profit. In that particular sense, then we believe it's not going to be sustainable going forward. But we are saying as Health and Allied Workers in the Trade Union, bring it on. Let it collapse in front of all of us so that it can prove to all of us that in Africa, in as far as running successful organizations, it simply means we are useless.
Sicina, thank you very much. That's a very passionate response to my question. Bring it on, you said. Thank you for joining us this morning.
Thank you very much, my leader, for having us.
You're welcome.